There are two types of azoospermia. We have obstructive azoospermia and non-obstructive azoospermia. Obstructive azoospermia means your testis is producing sperm cells, but something is blocking it. Non-obstructive azoospermia means nothing is blocking the sperm, but it is the testis that is not producing. And there's something we call testicular failure, which means the testis is not producing again. It can happen to any stages of men. Even a virgin, a man that has not even known a woman before he married his wife, can be azoospermia patient. So that is why when you find out that you are having problem with your semen, the best thing for you to do is to go to laboratory, go and run test, let them know the type you have. If it's non-obstructive, life no end. There is a solution for you to give your wife pregnant. When they place you, they will do a hormonal test for you, do some tests to ascertain the functionality of your testis. If they find out your testis is working, that means you have a blocked sperm duct. That is obstructive azoospermia. Then there are some people too, they are born with absence of what we call fast difference tube. This is the tube that carries sperm from inside the testis out to male accessory organ before the fluid meet to them and come out. Some men are born without this tube. We call it fast difference tube. If a man is born without this tube, that means baby, sperm cannot be inside his semen. But if you find out that you are obstructive azoospermia, the best thing you do is you can go and do sperm retrieval. There are some professionals, they know it. Talk to them. Instead of you to start taking this, taking that, go to professionals. They will help you out. I'm telling you, they will help you out. There are different types of sperm retrieval. We have epididymal sperm retrieval, we have tessa, we have MESA. These are the procedures they can use to get sperm cells or get sperm out of a man. So this night, this is where I will stop concerning male fertility test, which is sperm semen analysis. Like I told you at the beginning, I said semen analysis is not a fertility test. It's just a test to determine testicular capacity of any man to produce sperm cells. If you find out that your wife is very young, lesser than 30 years of age, and every other test is okay, and you yourself, your sperm is okay and very good, you can go and do sperm function test to know whether your sperm can fertilize a egg of a woman. There's a test we call sperm function test. This test is different from semen analysis. As professional, I'm telling you, they will be able to tell you what is wrong with you. Chichi, you are welcome. You are saying this is your first time. So now, the time is open now for any one of you to ask the question. Can azoospermia be treated? I've told you, azoospermia, if it is obstructive azoospermia, it's better you go for sperm retrieval. That's what I mean. Go for sperm retrieval. It's better like that. Is there a cure for blockage tube? If the tube is blocked, then depending on where that tube is blocked, then if it is not too much, you can go and do hydrotubation. What you can use for hypolactin, everybody knows that one. Go and do the test first. Let's see the value. Sinego is there, Paloda is there, bromocriptine is there. Then, can start be responsible for oligospermia? No. This is what they make all of you to believe, that it is infection that is reducing sperm cells. How? If infection is the one that goes inside your testis to reduce the sperm cells, that means your testis will swell up. So I'm telling you, it is not sperm, it is not staph. Go and do further tests to know whether it is your testis that is not performing. Sir, what is the best drug for low progesterone? There is no any best drug for treating low progesterone. Progesterone will be managed for a woman to get pregnant. When the person get pregnant, you manage that hormone. There are 4 ways you can manage progesterone. Maybe during all this live chat, I'll be talking about them. But that you want a permanent treatment for low progesterone is not possible. EMC is metformin good for treatment of hypolactasia? Metformin is not the drug they use for prolactin o. Metformin is the drug that they use to reduce sugar in your body due to so that the PCOS could leave your body. So if anybody is giving you metformin because of hypolactin, is a wrong diagnosis or wrong treatment. Sir, AMH 10.6 is it good? AMH or 10.6 is not good. The best result for AMH is from 1 to 3.5. Anything higher than 3.5 is PCOS. Anything lesser than 1.0 is low ovarian reserve. Please, how can one reduce IME? That means they are going to treat PCOS for you and go to the laboratory, go to meet professionals. They know what to do for you. If you meet good professionals. Yes, I want to do IVF and the gynecologist said they will drain the fluid. It's possible, but they must drain the tube or you go and do hydrotubation to clear that hydrosalpinx. Because if you go ahead and go and do IVF with hydrosalpinx, I'm telling you, you have a failed IVF procedure. So it's better you treat it very well and find out that if you get to that, it is cured. Is there treatment for low ovarian reserve? I can tell you that there is a treatment for low ovarian reserve, but it's dependent on the age of the woman. For any woman above 40 and you have a low ovarian reserve, one need to know the level. For any woman that is lesser than 35 and has low ovarian reserve, then if you take the right drugs, the ovarian reserve can be improved. And let me tell you today, women, one of the things that make woman to have a low ovarian reserve apart from age is contraceptives. It is not good. I'm advising you, it is better you go and have sex and find out whether you are pregnant and know what to do with pregnancy than for you to keep taking contraceptive every month because you don't want to get pregnant. At the end of the day, this drug will deplete your ovarian reserve, and by the time you say you now need a baby, your ovary will not be producing a good quality egg again. So it is not good. What if one tube is blocked? If they manage that person very well, they can use one tube to get pregnant. I have done ectopic pregnancy before. Can I ever get pregnant again? Yes, you can get pregnant again. But don't forget, you have 2 tubes and you have 2 ovaries, 1 tube. 2 ovaries, 1 tube. So you need to be monitored to ensure that the ovaries that have tube is the one that is ovulating every month. If the ovary that does not have tube is one producing egg every month, it will be very, very challenging for you to get pregnant because sperm and the egg must meet inside the tube. My name is Woja Adekende Samuel. I'm the fertility scientist at Fertility and Andrology. Till I come your way tomorrow.